Hello, and thank you for joining this webinar on HealthChoice Illinois, the new Medicaid Managed Care program in Illinois. This webinar is intended for Department of Human Services employees, providers, and other stakeholders. It is organized into two parts. The first and longer part is content developed by the Illinois Department of Healthcare and Family Services, which administers Medicaid managed care. The second portion of the webinar will contain some specific content intended for the DHS audience. So let's begin. Illinois is in the process of launching a new statewide Medicaid managed care program called HealthChoice Illinois. The goal of this program is to transition to a streamlined, accountable, and integrated managed care program that delivers member-centric care, enhanced quality, improved outcomes, and sustainable costs. HealthChoice Illinois began launching on January 1st of 2018, and it features significant changes to both the populations and the geography that are involved in mandatory managed care. The first major change under HealthChoice Illinois is the geography of those affected. The HealthChoice Illinois program in Illinois will be statewide. Additionally, the populations that will be enrolled in the managed care service delivery system are expanding. Most managed care populations that had been enrolled previously, including parents and children in the Family Health Plan, Affordable Care Act adults, individuals enrolled in the Integrated Care Program, and other individuals enrolled in managed long-term services and supports will also be enrolled in mandatory managed care under HealthChoice Illinois. But HealthChoice Illinois will also include some newly eligible populations, including children who are enrolled in supplemental security income, as well as children who receive services from the Division of Specialized Care for Children, as well as the Illinois Department of Children and Family Services. An important exception to enrollment under HealthChoice Illinois are persons who are enrolled in the Medicare-Medicaid Alignment Initiative, sometimes referred to as MMAI. Those individuals will not be enrolled in HealthChoice Illinois. The overarching goals of the new managed care program are to improve health, enhance the experience of care, and lower costs by focusing on a handful of strategies. These strategies include paying plans for value, quality, and outcomes, coordinating care effectively, focusing on prevention, integrating behavioral and physical health, reducing unnecessary emergency room visits and repeat hospitalizations, transitioning members from institutional to community care, and using new data integration and predictive analytic tools. Seven plans are contracted with the Department of Healthcare and Family Services to deliver the Medicaid program under HealthChoice Illinois. 5 of these managed care organizations will take enrollment statewide, meaning members across the state may choose these plans. Blue Cross Blue Shield of Illinois, Harmony Health Plan, Illini Care Health Plan, Meridian Health Plan, and Molina Healthcare of Illinois. 2 of the contracted managed care organizations in HealthChoice, Illinois, will only serve enrollees in Cook County. Those plans are County Care and Next Level Health. Contact information for each of these health plans is available on the Department of Healthcare and Family Services website under Care Coordination. HealthChoice Illinois will cover all Medicaid state plan services, including hospital services, physician services, mental health, alcohol and substance abuse services, laboratory and x-ray, medical supplies and equipment, transportation, hearing services, therapy, hospice, home health care, pharmacy, vision, and case management. Additionally, HealthChoice Illinois will cover home and community-based services available through various Illinois waivers. But there is one important exception, and that is that the HealthChoice Illinois contracts currently exclude developmental disability waiver services. Now let's focus in greater detail on the scope of HealthChoice Illinois. HealthChoice Illinois is a statewide program, and it will operate in all counties. When enrollment efforts are complete later this spring, 80% of Medicaid enrollees in Illinois will be receiving their covered services through a managed care organization. The roughly 20% of enrollees that will remain in the fee-for-service system include these excluded populations. As I mentioned earlier, dual-eligible adults who are enrolled in MMAI will not enroll in HealthChoice Illinois, nor will dual-eligible adults who are not receiving nursing facility or waiver services. Other excluded populations include participants who are American Indian Alaskan Natives, unless they voluntarily enroll in an MCO, participants who are only eligible with a spend down, all presumptive eligibility categories, participants who are enrolled in partial or limited benefit programs, and participants who have comprehensive third-party insurance. Now let's take a look at the HealthChoice Illinois timeline. Phase 1 took effect on January 1st, and it impacted individuals who were already enrolled in current mandatory and voluntary managed care programs. So these are folks who had been enrolled in managed care prior to January 1st. And they went into the HealthChoice Illinois program on January 1st. The second group, or Phase 2, includes persons who are in new geographies, that is, those counties where there had not been managed care previously, as well as those new populations. Their enrollment in HealthChoice Illinois will be effective on April 1st. Phase 3 includes those special needs children that I mentioned earlier who are enrolled in SSI or receiving services through DSCC or DCFS. And the target date for their enrollment in HealthChoice Illinois is July 1st. This slide expands on the timeline for those 3 phases and shows the date range when each group will be mailed information about the new program, as well as the date on which they will or may be auto-assigned to a plan if they have not already selected one. There's a lot of detail here, so I'll pause to let you take some of that in. And I'll also call your attention to the very important footnote at the bottom of this slide. All individuals will have a 90-day switch period to select a different plan. Now let's take a little bit closer look at phase one, which affected members who had been enrolled in managed care in 2017. The transition of those individuals, which is more than 1.9 million persons, were effectively transitioned to HealthChoice Illinois on January 1st, 2018. All of those members have received notice of their health plan assignment, and if you're interested in viewing sample member transition notices, they were posted on the HFS website under Medical Providers Care Coordination. The link is provided here. Samples include notices issued by the managed care organizations, as well as by the client enrollment broker. These materials were carefully reviewed by internal and external stakeholders. Referring back to that footnote I pointed out, all transitioning members had a 90-day period to switch MCOs starting January 1st, 2018. In order to change, the member must call the client enrollment broker or go online to the client enrollment broker program enrollment portal to request a plan switch. There was no phase-in or choice enrollment period during the transition, and no new geographies were added for phase one of a HealthChoice implementation. The HealthChoice Illinois enrollment resets each member's anniversary date and annual open enrollment period. Please note that a member's redetermination date is a separate date and not connected to the member's anniversary date. We also want to just go over what happened for individuals who had been enrolled in managed care in 2017, but had been enrolled in plans that were not going to be serving Medicaid members under HealthChoice Illinois. For the managed care organizations that were exiting the program, they were required to provide each member's new managed care organization all of the open prior authorizations, including prescription drugs and durable medical equipment, as well as current care plans. The MCOs who were receiving members from the exiting plans were expected to honor all open prior authorizations for 90 days. And the MCOs continue to be required to provide a 90-day continuity of care period for individuals by paying all current providers, even if they're not in network with the new MCO. That's a 90-day continuity of care period. Now we'll talk a little bit about phase 2 and 3, the expansion of managed care. Phase 2 and 3 will feature mandatory enrollment for the newly eligible populations in phase 2, including those new populations that live in regions of the state that had mandatory managed care in the past. And phase 3 will consist of special needs children. This expansion will hit the new geographic areas. Managed care will be in all 102 counties, including all counties outside the 5 mandatory managed care regions. and it will include previous Illinois Health Connect members. Please note that the Illinois Health Connect plan closed on December 31st of 2017, and all of those members went temporarily into fee-for-service effective January 1st, 2018. You can find a sample Illinois Health Connect member plan closure notice on the HFS website. Starting in January 1st, 2018, individuals in fee-for-service but not yet enrolled in an MCO can get information on their benefits or help finding a doctor from the HFS Health Benefits Hotline at 1-800-226-0768. The TTY number is 1-877-204-1012. That is a free telephone call. Phase 2 potential enrollees, the client enrollment broker began mailing enrollment packets for Phase 2 in the week of January 18th and wrapped up those mailings in February. The effective date for Phase 2 enrollment is April 1st, 2018. And the Phase 2 90-day plan switch period begins April 1st, 2018. Phase 3 potential enrollees, who are special needs children, have a tentative mailing date of May 8th, 2018, with a tentative enrollment effective date July 1st, 2018. The 90-day plan switch period tentatively begins July 1st, 2018. Each potential enrollee will have a 30-day choice period. If no choice is made, a plan and a PCP, as applicable, assignment will be made via the auto assignment algorithm used by Healthcare and Family Services. Now let's shift our focus to talk about member engagement and communication, both of which are critical to the success of HealthChoice Illinois. Education and enrollment packet materials were shared for review by internal and external stakeholders. HealthChoice Illinois education and enrollment packet materials include an enrollment letter, which states both the plan and the primary care provider assignment, a brochure, a comparison chart of the health plans, as well as a report card and tips sheet. Sample materials are available at the HFS website. As many of you know, Illinois has relied on a client enrollment broker to support Medicaid members as they enroll in managed care. The role of the client enrollment broker remains the same under the HealthChoice Illinois expansion. The client enrollment broker provides unbiased education and enrollment assistance, facilitates the initial 90-day plan switches, as well as facilitates the 60-day annual open enrollment periods. The client enrollment broker educates members on each plan's benefits and provider networks based on the information provided by the plan. The client enrollment broker will also recommend that a client contact the plan's member services line for more information on their provider networks or covered benefits. The client enrollment broker records all calls and can monitor online enrollment activities. Community-based service providers that want to help their clients navigate this process should know that the CEB will require a client to verbally confirm that an individual or organization is an authorized representative and may make decisions or facilitate decisions on their behalf, or the client enrollment broker will have to have received a record of written authorization. All clients that have questions about their managed care enrollment should be directed to the client enrollment broker for more information about their choices and for program education and enrollment assistance. The number for the client enrollment broker is 877-912-8880, and the TTY number is 866-565-8576. That's a free call. The client enrollment broker can also be engaged online at http://enrollhff.illinois.gov. Now let's talk about how health plans will work with their members once they are enrolled. All members will receive ID cards from their health plan to use when they're accessing services. And they'll get these new cards even if the member stays with the same plan that they were enrolled with in 2017. Once a member is enrolled, the MCO will send a welcome packet that includes a member handbook with a lot of very important details about how they will access services. Health plan members may switch their primary care providers within the MCO according to the MCO policy. For someone who's enrolled in a health plan but wants to change their PCP, they should contact their MCO member services line directly to request that change. The managed care organizations are required to assign care coordinators to certain high-risk members and all waiver members. However, any member may request care coordination by calling the MCO's member services. It's important to note some of the differences between HealthChoice Illinois and earlier managed care programs in Illinois. Some of these differences are especially important for community-based providers. The first key difference is that there will be a single contract for managed care. Most previous managed care populations fell under one contract or another. We had separate contracts for family health plans, ACA adults, integrated care program, and managed long-term services and supports. But under this iteration, under HealthChoice Illinois, all of these populations will be covered under a single contract between the state and a health plan. The Medicare-Medicaid Alignment Initiative, MMAI, will continue under a separate contract, so that's not rolling up into the HealthChoice Illinois contracts. Additionally, all providers will have to be credentialed in the IMPACT system. IMPACT enrollment is the primary mechanism for credentialing. Managed care organizations may still need to collect certain information for operational purposes if it's information that was not collected under IMPACT. Things like office hours and details related to site accessibility. Effective on July 1st, 2018, there will be a single preferred drug list, and all MCOs must use this preferred drug list. MCOs may continue to waive copayments, and they also may impose utilization management controls unless those controls are otherwise prohibited by law. MCOs will be required to expedite provider payments for providers on the HFS expedite list. For providers who really want to educate themselves on the HealthChoice Illinois program and what it means for them and for their customers, HFS has issued a series of provider notices regarding the launch of HealthChoice Illinois. These notices include information about how to work with managed care organizations that did not receive a contract for HealthChoice Illinois. They'll include details on the new program. It'll include information, these notices include information about how HFS and the MCOs will communicate transition details to members, and information about how to work with MCOs serving persons who are eligible for full Medicare and Medicaid benefits. Those are dual eligibles. All of these provider notices can be found at the HFS website at this link. We also want to offer some tips for providers that may still be unsure how to proceed. It's very important that you initiate and prioritize the contracting process. Providers have to contract with health plans if they want to receive payment for Medicaid services that are delivered to Medicaid members who are enrolled in the MCOs. And as we discussed earlier in this webinar, that's going to be about 80% of the Medicaid population in Illinois. So it's essential that you enroll with health plans if you want to continue serving Medicaid members. Credentialing under HealthChoice Illinois has been simplified, but it's also important to remember that the contracting process, the process by which providers enter into agreements with the health plans, may still require substantial administrative resources. We encourage community-based providers to review the health plan's model contract. It's available on the HFS website, and it includes a lot of important details that providers who are contracting with health plans should be aware of. The HealthChoice Illinois contract includes network adequacy requirements and caveats for certain types of providers. The managed care organizations may not refuse to contract with certain kinds of providers, such as federally qualified health centers, rural health centers, and community mental health centers, and nursing facility and waiver providers that are willing to accept the MCO's rates and contractual requirements and meet quality standards. Consistent with the state's shift to paying for value, quality, and outcomes, the HealthChoice Illinois MCO contracts include pay-for-performance incentives for the health plans. The managed care organizations may offer value-based payment incentives and/or fee-for-service rates to providers. Providers should ensure that they understand all of the payment provisions offered by the MCO. We are concluding the portion of the webinar that consists of content approved by the Department of Healthcare and Family Services. If you have any questions about the materials that we've covered so far, they can be sent to the Department of Healthcare and Family Services at hfs.carecord@illinois.gov. Now we've come to the tail end of the webinar where we're just going to go over some specific additional content that was approved by HFS for sharing with DHS employees and providers and other stakeholders. First, we wanted to share with DHS employees information about resources that they can either use themselves or refer their customers to if they have questions, concerns, or issues about this process. Customers who have questions about the enrollment process or who need help enrolling in or changing their health plan, they can be directed to the Illinois Client, excuse me just 1 minute. Those customers who have questions about the enrollment process or who need help enrolling in or changing their health plan can be directed to the Illinois Client Enrollment Services at 1-877-912-8880, or they can be engaged online at www.enrollhfs.illinois.gov. Customers who are already enrolled in a health plan and have health concerns or need help accessing health care can be directed to their health plan's member services number. That's posted on the HFS website, and we will work on distributing the telephone numbers to various DHS service sites. We also wanted to provide a very friendly reminder for DHS caseworkers. Accurate data in the county field in IES is vital for appropriate health plan assignment, since certain plans serve only Cook County residents. When entering a customer address and processing address changes, please make sure that county information is correct and up to date. Enrollment of customers into the mandatory managed care programs, HealthChoice Illinois and the Medicare-Medicaid Alignment Initiative considers their county information first. So confirming that customers' county information is correct minimizes unnecessary disruptions in their health plan assignments and access to health care. This concludes the webinar on HealthChoice Illinois for DHS employees, providers, and other stakeholders. If you have any questions or concerns about this material, please feel free to contact me. My name is Gabriela Maroney. My telephone number is area code 312-793-1733, or I can be reached at gabriela.maroney@illinois.gov. That's GABRIELA.MORONEY@illinois.gov. Thank you for joining us and for your patience with some of the technical challenges.